Feeling down from time to time is a normal part of life, but if you feel you're stuck, there are some ways to help you get your life back on track. That's when we called in Dr. Rob. He's got to look at some of the symptoms of depression and therapy to treat them. Welcome back.
It's good to be here as always. And haven't we all at one time or another in our lives felt blue or down or depressed?
Sure.
And then the unfortunate ones who have severe clinical depression. It goes on for days, weeks, months. Well, we have tips today to help you overcome those down days, those blue days that we all have.
We want that sun coming back up. I suffered postpartum depression with both of my kids, so I can relate to this and some of the symptoms myself. Can we talk about them?
Absolutely, and I've been there as well. And with postpartum depression, what we're really talking about is a loss of hormones.
Yeah.
In particular, when you were pregnant, that hormone called progesterone was through the roof.
Yeah.
And then after you delivered, it drops really low, and a lot of women suffer from postpartum depression.
Sure.
And all you needed was a shot of progesterone, and bam.
Bam!
You'd be surprised how well that treats postpartum depression when you bring those hormone levels back up. But everybody has at some time in their life some kind of depressive things. Something happens in their life, a death in the family, financial crisis, losing a home. There's so many things that can affect us and stress us, and along comes the depression. So things that, you know, bother a lot of people, they get angry, they get frustrated, anxious, they lose their focus, inability to concentrate.
That helplessness was a big one.
That blue or like a fog that just seems over everything, and no matter what they do, they just can't get rid of it.
Sure.
Yeah, a lot of very common symptoms.
So there are some things, you mentioned progesterone and things like that, that we can kind of cure some of the, or not cure, but kind of help with the therapy.
Can certainly help. And one of the things that everybody really should do is seek counseling with a certified counselor. Spend time talking about it. Get those feelings out. Express what's bothering you. Exercise is another great one, of course.
Get those endorphins.
That's right, those endorphins, those enkephalins, get out those feel-good hormones, get those pumping, right? And then healthful eating, because you can't make the neurotransmitters and the enzymes and the hormones that your body needs to feel good if you're not eating healthy fats. So healthy fats are very important. But what I really want to talk about is hormones. And I have a question for you.
Yes.
If you were to look at all the research on hormones and depression, how many studies do you think there would have been over, say, a 10-year period on hormones?
It have to be thousands, I would think.
It's not only thousands, it's hundreds of thousands. Just in a 10-year period, from 2001 to 2012, there was 492,000 studies on hormones and how they positively affect depression. In particular, thyroid, there was 253,000 studies in 10 years about how thyroid hormone can improve depression. And so there's other items as well, certain supplements like methylated B vitamins, cognitive aminos, getting that vitamin D, which is really a hormone, up to levels a little bit higher than what are normal can be beneficial as well. So combination therapies along with hormones can be very helpful at helping get over the symptoms of depression. And what we found in treating our combat veterans, Afghanistan, Iraq, Vietnam vets, is that they suffer from all these problems in our treatment protocols in using these different supplements, high doses of cognitive aminos, high doses of methylated B vitamins, getting their vitamin D hormone appropriately treated, and then correcting the hormone deficiencies that we see, their depressive symptoms ease up. And then they can come back to life and be that happy person that they once were, right? Yeah.
Which is what we want. Talk to somebody. If you are feeling down, go talk to Dr. Rob. We can find you where?
At renewhealth.com.
Excellent. Thank you so much for being here.
Great to be here as always.
You know what